Hi, everyone, and welcome. Thank you so much for joining us today for the Planning for Future Care, a Care Partner Perspective webinar that we're hosting today. I know that we've got some people filtering in on the waiting room, so I will just start introductions and then we can get going. My name is Kat Kershaw. I am an Education and Support Services Coordinator here at Parkinson Society BC, and I'm really pleased to be here with you all today. I would like to start by acknowledging that we're gathered on traditional, ancestral, and unceded territories of Indigenous peoples across British Columbia. And we're grateful to live, work, and learn on this land. And we honour the resilience, knowledge, and contributions of Indigenous communities, past and present. As some of you may have seen from my email yesterday, sadly, our original presenter was unable to join us today. And we do hope to offer this session again in the future in presentation format. However, because it's such an important topic, I'm really glad that we've actually been able to still meet today and just come and share a different format in a panel discussion. So before I introduce our panel, I just wanted to cover a quick couple of notes. So at the end, we will have time for questions. So please feel free to use the chat function throughout the session, and I can ask our panel on your behalf, or you're more than welcome to raise your hand at the end and speak to the panel directly during that Q&A portion. We are also recording today's session, and we will share that recording with you along with any relevant information and resources in the coming days. So keep an eye out for that email. And so with that, I am delighted to introduce our panelists. So today we're joined with Bill and Saeed. So I'll start with you, Bill. So Bill was the first to introduce Right at Home services to British Columbia and manages operations, marketing, and enjoys being a care planner for many families. At Right at Home, Bill strives for his team to improve quality and integrity of the care service offerings and focuses on client satisfaction, innovation by bringing best practices to a local context, by leveraging Right at Home's internationally proven systems of quality care throughout the Greater Vancouver area. Bill's hometown is Vancouver, and he's keen to give back to the community that he cherishes so much. He has a genuine interest in raising the bar for home care services, having faced personal hardships around his mother's bouts of breast cancer, colon surgery, as well as a severe fall-related injury. Bill is a volunteer in the community and has been a member of the Alzheimer Walk Committee and sponsored activities with other organisations like the Parkinson Society BC. So thank you so much, Bill, for being here.
My pleasure. Thanks, Kat, for allowing me to participate.
And last but not least, we have Saeed. So Saeed is the franchise owner of Nurse Next Door Richmond, BC. Growing up, Saeed saw his parents take care of his grandfather who battled brain cancer and realized that the toll that it took on his parents, managing work, raising kids, and being a full-time caregiver. This increased his appreciation for the noble profession of caregiving and the impact that it can have on seniors and families alike. Saeed and his wife Noreen have long been residents in the Richmond community and are passionate about supporting seniors and those in need through premium home care services. He has seen firsthand the difference a handful of regular care hours can make for their clients and families. And Saeed and his team handle the caregiving so that families can focus on being families again. Thank you so much, Saeed, for being here.
Thank you, Kat, and thank you everyone for attending.
Amazing. Alrighty, so now that we've met the panel, I guess to start us off, maybe I'll start with you, Bill. So from your experience working with individuals and families affected by Parkinson's, what are some of the common challenges you see caregivers facing when they start thinking about future care planning?
So I'll just highlight a few from our experiences. One is that although there are commonalities with Parkinson's disease care, there are also differences. Each individual is different. Each care plan is different, and being able to adapt to the specific person that we're caring for and not cookie cutter it and assume every person undergoing the journey with Parkinson's is the same. So that difference based on the individual is one. The second is mobility. Sometimes when we start the care, the person may have the ability to walk, maybe with a walker. Then when they start to lose elements of mobility, things as basic as getting up from the bed onto the walker or getting out of the sofa, these pose challenges for our care. We have mechanisms and protocols how to undertake that progression, but nonetheless, these are typical challenges when the condition progresses with providing challenges on the mobility front. The other is cognition. Some of our experiences is that you cannot just look at the physical care elements of Parkinson's care. Sometimes the mood swings, the challenges for that individual coping with the transition that they're going through triggers challenges on the cognition side. And given a lot of our clients are paired with other conditions like dementia, given it's mainly senior care, being able to not only be a good physical support person, but supportive on the cognitive side. And others is things take time, things such as just eating. We have some clients it takes an hour and a half to eat a lunch, and a caregiver needs to be incredibly patient and persevere. Otherwise, it will affect their health and nutrition if they're not eating properly. We have solutions to cope with that through management oversight. We also have a wealth of information from 30 years of providing care across the world through Right at Home University. So we feel we can train our staff, and we think it's also important that we follow a regimented care plan with routine because routine is so pivotal for Parkinson's disease care. So those are some of the common challenges. But once again, I don't think any individual is the same.
No, that makes sense. And I guess it's a lot to think about, especially when you're starting out that journey or it's in the early stages. And one of the most common questions that we hear is, how do I know when it might be a good time to bring in additional support? So I guess from your experience, Saeed, what are some of the signs that extra help at home could be beneficial, not only for the person with Parkinson's, but also their care partner and loved ones?
I think that's a very good question, Kat. And essentially, this is something that we see, and I'm sure Bill can also agree with that. We see it day in, day out with families, with clients as well. So how I sort of look at it is basically two-faced. So sometimes we can recognize those red flags that might be happening with regards to the person at home. And the second thing is, like you say, with the care providers at home, how do they know like it's good for them? Maybe there are burnout signs as well. So I'll answer it in twofold. So number one is red flags. So maybe the loved one that you are taking care of, they're seeing some near misses. Maybe they're furniture walking. Maybe they're relying more for support, more so than what you would have previously seen them doing. Those are all signs that maybe it's time to bring in some sort of care at home, some sort of care support at home. Maybe there are some struggles with ADLs at home. Maybe they're not able to take care of things that they were able to do previously that well. Medicine is very important. Medication management is very important in Parkinson's. I think following a set routine, like Bill mentioned, is extremely important as well. So making sure that the medication management aspect is taken care of. And if you start seeing some issues there, all of those things sort of point you in the direction that maybe things that were working well so far, they need a little bit more oversight. They need a little bit more supervision and management. So maybe that's the first part that families can look out for. Secondly, I think also families can introspect and look at themselves, because I think caring for a loved one is a full-time job, as we all know. It does take a lot out of an individual, and maybe like there are things on the caregiver's side that can sort of that can sort of signify that it's leading to burnout on their side. Things like, for example, maybe not being able to take care of themselves, maybe neglecting their own personal health, those kind of things. So I think as soon as families recognize that the red flags are happening on not only on the person's having the Parkinson's diagnosis, but also themselves, I think those are good times to start to have a discussion. Maybe having a few handful of hours can also make a big difference then and there.
Yeah, you make a good point there with the few hours. Because I think sometimes there's a misconception it's all or nothing. So I just wonder, what could that extra help look like? Does it need to be, could it just be a few hours? And would that, improve the situation potentially and empower? Um, what are your thoughts on that?
Yeah, that's a very good sort of like segue from where we were discussing what we were discussing. So, like you rightly say, Kate, like when we go to any client's home, we often like see this all or nothing feeling, which of course means that maybe people think or people feel that they would have to go for a very long care arrangement for something to work out, or that's necessary. So it's not at all the case. In fact, I think at Nurse Next Door we have clients that we care for 3 hours a day for 3 times a week. That's basically the most common type of support that we provide. So everyone's case and needs are totally different. So maybe for a family, overnight care is important because they are there during the day, and maybe someone being there overnight for their loved one is important. So that could be one way to sort of approach care. Maybe having a little bit of respite here and there. Maybe there is a bigger family and they have support during the week, but maybe a couple of times during the week they're all tied up. So maybe those 2 or 3 days could be important. Maybe just keeping some companionship, like Bill was also saying, like a lot of the times the common things like having a lunch can take a long time, and often families have, of course, other activities that they're busy with. So maybe having that sort of companionship during those hours could be very important as well. So again, it's not an all or nothing sort of a situation. Like I say, even like 3-4 hours per week, 5 hours per week, starting slow could be important. And again, looking at the situation, what the families need, if it's overnight, if it's respite, and go from there.
Yeah, no, very true. I guess like the main thing is, it's got to work for you and your family, and it's trying to find the best solution for the current situation. You spoke there, Saeed, for a few different types of care. And so I'm just wondering, Bill, some of those words can be very overwhelming if you're not, if this is something that you're navigating for the first time. Would you be able to just walk us through those different types of supports? So the companionship, personal care, respite, overnight support, and maybe when each of those would be a good fit.
Sure. Thanks. I think one of Right at Home's hallmarks is we almost always will say yes. So I think it's important that we can our caregivers, in the time they're with the client, they can handle the full spectrum of care, or we call it holistic care. Companionship is, so what that means is we can manage things as at one end of the spectrum, which would be companionship, light housekeeping, maintaining the household, all the way through personal care, which is touch-based care, bathing, grooming, toileting, all the way to, palliative care or very in-depth elements of care. For example, operating a lift within the home. So unless it's specifically required by law to be done by a nurse, for example, an injection or a medication that's PRN based, which is discretionary, our caregivers say yes. And I think that's very, very important for families to know. Sometimes families need rest during the night, the family caregivers, and so some families opt for night care. Sometimes, as Saeed mentions, it's respite. So if someone's burning out, taking care of mom or dad every night of the week, having 2 nights where they can just sleep throughout the night, not be awoken, and have right at home caregivers in there is really, really important respite. So we do care any time of the day or night that the family requires. So yes, the other thing to note is it's important that a caregiver is continual and consistent, and therefore the qualifications of staff need to be more advanced than the original. So if you hire someone that you think you only need them for companionship, but 2 months later they have a fall, if they're not able to take the care to the next levels, then you have to detach that caregiver and find a new person. And some of our clients bond with our caregiver almost like they're part of the family. So we do not want to detach them. We have clients that they're receiving the same care team, the same caregivers for 2 to 3 years. So being able to have every caregiver in our system be able to do anywhere from light housekeeping, companionship, all the way to advanced care is very important because this condition is progressive.
Yeah, that's a really good point. And I guess in terms of, with Parkinson's being progressive, as families navigate that care planning journey, they may at a time need to decide between receiving home support, home care in the home, or considering long-term care or residential care. From your experience, what are some key considerations for this decision?
I think this is like almost a crossroads when the family unit is not able to fully care for that individual, and or the person's condition progresses that it's almost unsafe for the family. Usually family unit are not professional caregivers, and they come from a perspective of love and care, but there are qualifications sometimes needed. So they hit that important crossroad. It's the same individual, it's the same market, it's the senior market, and some opt to go down the facility path and others home care. I don't think there's a right or wrong. I mean, both offer immense benefits, but they're not the same either. If you think about home care, usually people that gravitate toward home care are ones that really require to be in the place that they grew up, where their memories are, familiarity. Nothing can replace home. And if that's the overriding principle, then we will come in and provide support so you can live at home as safely and long as possible. The other thing to know is budget. If the budget is the same, you have to think about where that cost is going toward. In home care, almost the entirety of the budget is allocated toward one-on-one care. Someone that will sit in front of you, watch you, customize everything to your needs. If you go into a facility, most of the time you're alone. But the benefit of being in a facility is they'll have a team of people within the facility. So if there is a need for someone to come in and assist, they have the supports. But no one will sit in front of your mom and dad through the entirety of the shift. So your budget is allocated more toward room and board, and on a more tertiary level, the care supports. But it really depends. I think both, if you're striving for having a social network, you're very lonely and you want to meet more seniors and join activities, well, home care is not going to be able to provide that for you. But if you're looking to develop a deep bond and almost like a family member, then that's home care. So it really depends on what's the overriding priorities of someone going and coming to that important crossroads.
Yeah, it's very reminiscent of how you said at the start, where there's no cookie cutter. It's very personal. And I think that leads perfectly on to my next question, where, planning ahead and thinking about those times can feel really intimidating for families, especially early on in the Parkinson's journey, as you're just navigating that diagnosis, or maybe, you've lived with Parkinson's for 10 years. Saeed, I guess, like, from your perspective, what are some small or practical steps that families and care partners can take early on to feel prepared, but not feel like they're moving forward too fast?
That's a really good question, and something that is very important, as healthcare it should be as much proactive as possible. And oftentimes we react to the situation that's happening, but now that we know that someone has a Parkinson's diagnosis, like, what can we do to be more proactive? So essentially, like you said already, every family is different, so everyone's situation would be very, very different. But what I could certainly share from experience is that having those conversations within the family unit, within the close circle of the client, and seeing like what they would like to do. I think the preferences is very important. So making sure that you take account of their wishes. Going back to your previous question, Kat, like essentially the difference between facility and home care. So having those conversations as well. Should the situation get a bit harder, what would they like us to do? Would they like to live in their own house or in their own community? Having some very important discussions if the family is prepared for it, around advanced directives and around the power of attorney as well, so that as a family unit, you're all set up in those moments of transition. And then with regards to the care for an individual, I think having those conversations around starting slow, like a lot of times families come to us and they feel that they know that over time they would require a little bit more support, but maybe at the moment it's good to start small and just having that consistency of that same person coming in, building the relationship like Bill was saying, and having things started and having a care plan in place, so that as things, I guess, progress and get a little bit stronger in terms of the Parkinson side, there is already things that we can do to essentially tweak and navigate the care plan. So having that as well, but also more importantly, having a more holistic view of the care as well. So I know that everyone's living situation and circumstances are different. So some houses may have like more rugs on the floor. Some may have less lighting. So having like professionals come in, like occupational therapists and all that, can also make a big difference, where they can take a look at the living situation and make some recommendations, like maybe getting rid of some of the rugs, maybe putting more lighting where it's a bit not as well lit as it should be, putting more grab bars as well. So starting small with these things, maybe complementing it with a little bit of home care, and at the same time having those discussions a bit earlier on, just to know like what are the wishes of the individual. That's how I would suggest families can start to approach as they navigate this journey.
Can I just add to this? Because this is a really, really important point. I'm going through this with my own parents who are, in their early mid 80s, and letting go of that independence is not easy. My dad still insists on driving, and yet at night his vision is impaired. And so we have to understand that that person takes incredible pride and dignity, and that independent is paramount to them. So how we modify and approach this is super important. So we advocate for a gradual process. Yes, the caregiver can do everything, but what's wrong with sitting down with the individual and folding the laundry together? That is a task the caregiver can do by themselves, but rather than say, sit on the sofa and I'll do it, it's like, okay, well, this is an activity. Why don't they sit and order groceries together? That allows them to be participating in that. We believe mobility retention is super important. If they can even walk a couple of times a day back and forth from the bed to the dining table, and you do it every day for weeks and months, you're going to retain some elements of mobility. But if you do all the care at the bed, all of the peri-care, you're going to lose that quicker than they need. At the same time, you're losing some of that dignity and independence. And so there's an individual in there with thoughts and pride. And I think this is really, really important so that the care succeeds. There are other examples. You take this away too quickly, and then they will resist the visits. They'll only want the daughter. They'll only want the son. And if we can make that transition with them. We have sometimes the families are like, no, I'll only bath with the caregiver. I'll only go with a walk with the caregiver. And so we want them to trust and believe that our caregivers respect them. And this is super important in how we approach care.
You took my next question there, Bill. So I appreciate that. my next question was going to be, yeah, how can families approach care planning in a way that still honors independence, preferences, and the dignity of, their loved one that's living with Parkinson's? You spoke a little bit there about what that balance could look like in practice. I wonder maybe I can tweak the question to maybe what does that conversation look like? How can the care partner support their loved one to keep their independence and honor their wishes?
I think an example is toileting, right? Like continence, incontinence. If they still have it, like asking you, whether it's a professional caregiver or your own mom or dad, asking them, to let them know and maybe assist them, because fall prevention is super important, particularly with ones that are not stable in how they ask them if they could assist them going to the bathroom. Those bathroom stops at the toilet will help retain their ability to know when, rather than do it entirely in their pull-ups. I think, planning, it's not just the meal today, but what about what should we have for the next week? And sit down with mom or dad, let their opinions be known, and map out a meal plan for the next 7 days, reflecting their preferences. So a lot of asking them, and that can come from the family caregiver. It can come from the caregiver that's, say, from nurse next door, right at home. But I think the more communication and respect and questioning of the preference of the person being cared for is super important. And also looking at them. We always tell our caregivers, don't talk through the family. Talk to the person you're caring for. Look at them. Ask them yes, it will take more time to get that response, but you don't look at the daughter and seek to communicate through the daughter. You communicate through that individual. And I think those same principles are important for family members as well.
Yeah, and that's a really good point. What could families look for in terms of signs, or maybe asking carers or agencies that would indicate to them that it would be a good match for their family?
Oh, you mean when looking for an private?
Yeah.
Yeah. I think we have to understand that we're usually brought in at a stage where safety is a concern. And so when you're looking at a caregiver, you should understand their professional qualifications. I think professional qualifications go to a certain level, but a base foundation is necessary. Common backgrounds of our staff are a nursing background. They may be a foreign trained nurse. They're not registered in BC, but that's a very strong foundational background. Others could be a registered healthcare assistant. Others may have a wealth of caregiving experience. So that's one. The second is probably the most important, in my opinion, and that's the heart of the individual that's caring, And this is where sometimes professional qualifications have a limiting level. We have caregivers that have phenomenal backgrounds, but they're just not compassionate and care. And I think if you see things like, they're not happy that the fridge is empty. One caregiver will say, oh yeah, I'll just make whatever I can put together, a grilled cheese sandwich with what's in it. Another caregiver will come and call the office manager, say it's not acceptable. There's no groceries. They care that dinner is not going to be good nutrition. They may even contact the family and say, can you stop by and top up the groceries? That's coming out of care. And when it moves toward compassionate care, that becomes very special. All of the other elements will fall into place. They'll be very attentive. They'll be patient. When they're treating the person they're caring for like a family, that becomes very special. And that's what families should expect, because they're coming in from a place of care and love. And when they can trust that our caregiver is going to give that love when they're not there, that becomes special. I think we should be raising the bar, as I stated, that, you know, that a caregiver really cares. The final is consistency. Like, it's important to understand that the caregiver can commit to that schedule. You know, if they're only available for the next 2 weeks and they, you know, that client really gravitates toward that caregiver, but they're not consistent and you're putting in replacements, well, this whole plan falls apart, right? So I think commitment and consistency and continuity is super, super important as families delegate more of care to a non-family member and trust them, is that it will be the same team, or sometimes it's just one caregiver. And next week they'll be there, the next week they'll be there in 3 months, they'll be there in 6 months, and that consistency of care. So I would ask, if they can make that longer duration commitment.
No, those are great points. And I think it kind of links back to the discussion previously where, like it's okay to talk about what do you want, what do you need, and that reflecting when you are looking for home care support, and finding that match. I guess then, Saeed, once that care support is in place, the relationship with the care providers become really important. What do you think helps create a positive and effective partnership between families and care providers?
Yeah, I think that's a really nice question and something that families reach out to us all the time with, because all of this navigation is so new for not only the person that is being cared for, but also their families. Sometimes we have daughters and sons who are calling us from out of province, from out of country as well, and looking out for care for their parents. So I think the most important thing to nurture that relationship is actually the trust element, making sure that there is someone there for answering their questions, answering the family's questions, whether it be late at night, whether it be early in the morning. So at Nurse Next Door, for instance, we have 24/7 care management. So we have someone at the office who's a nurse, who's a trained nurse, who's able to follow the client's case at any point of time, and able to respond to the family's questions, give updates, give them access to, I guess, our progress notes documentation that our staff is doing after every shift, knowing so that the sons and daughters are at peace reading through that, like how many minutes of walking or exercises did my dad do yesterday? What did he eat? What are the routines looking like? So having that sort of easy access to their progression day in day out, I think is very important. And then I think also over time, like Bill already mentioned in his last question, that consistency is very important, right? So having that from the office standpoint, I guess we can do all of these things where we are available for them 24/7, where we have a care designer in place who can answer any questions. But at the same time, having that consistent match so that over time the trust with the caregiver also builds in. Oftentimes, like we speak with the caregiver and we realize, oh, families are automatically just coordinating with them directly because they have that trust in that individual that is there to take care of their parents. So I would say like building that relationship depends on that clear match and having that access to the office team where there is someone there who can really answer their questions, and make sure that there is like from our standpoint, oftentimes in home care it's tough. Every day is so different. Sometimes we hear that there is a client who's going to hospital again and then coming back home, and then the care plan changes. So now there is a bit of collaboration needed. If let's say there is some sort of medication management needed, and now we need to bring our nurses on board along with our healthcare aides. In that case, I guess we may need a little bit of back and forth with the doctor's offices and all of that. We let the families know that we can handle that piece so that they can be a little bit more at ease, knowing that they just need to have this team in place, and once we are there, we can take care of everything. So to answer your question, it does take time, but over time, with all of these elements, it can certainly bring that peace of mind.
Definitely. And just keeping that communication flowing by the sounds of it. I guess that kind of leads me into my next question of, how can care partners and loved ones know when those adjustments to care might be needed, and how do they go about initiating that change?
Yeah, so I think it goes back to like initially what we discussed. I think having I think noticing and observing is very important. So like even having like seeing like those small changes that are happening, maybe there is a near fall miss that happened. Maybe there is someone who's feeling a lot more anxious walking around at night. Maybe like nutrition is a problem because they're not eating well. So having that like keeping an observant eye for all of those little details uh, gives the care partners a feeling that definitely there is something off and it needs a little bit more attention. So I would say like being close and getting a sense for what's changing, and that's where I guess we see day in day out a lot of our caregivers who actually start with a client working with them for 3 4 months, then they actually reach out to the families and reach out to us, of course, and throughout the process when we do our supervisory visits as well, we see that as well. So like keeping an oversight, whether it's through family, whether it's through organizations like Right at Home or Nurse Next Door with their teams, but having an informed eye and knowing that things are changing. And that's where I guess the care plan transitions are required. Maybe when the person started, they were okay to something as basic as like the care plan might say, like they're okay to maybe go out for a little bit of a walk with the help of a walker, but maybe over time mobility is an issue and they just can't go out. And maybe we need to do something inside with a little bit of mobility exercises. So all of those changes, I think, being on top of it, being proactive and being observant and noticing things as well.
Yeah, but no, there's a lot to think about. And I mean, we all know that caring for a loved one can be really meaningful, but it can also be really exhausting. So I guess, Sayed, from your experience, what are some ways that caregivers and care partners and families can protect their own well-being and maybe help recognize to, ask for help or maybe need respite?
Yeah, I think first and foremost, I would say that asking for help is most important. And knowing that, I think throughout this conversation, one thing that we, uh, I think, discussed earlier on as well, it's not all or nothing. It's basically meeting where the family is. So, asking for help is most important. Caregiver burnout is real. We see it all the time. And it's very stressful taking care for a loved one. So, if let's say there are signs, if there are indications that you realize as a care partner that you are really not being able to take care of your own health, maybe you're not able to get sleep most of the nights, maybe you have your own little ones and families to attend to, so that then and there, I think there is a sign that maybe you need a little bit more support. And everyone's situation is different, and support may look different. Maybe there is an extended family or extended social circle who can maybe pitch in and like come in for a couple of days and help you with a little bit of respite. Maybe if you are okay, we can like the families can discuss home care needs with organizations like Nurse Next Door, Right at Home as well. So everyone's situation is different, but just I think asking for help is very very important, because at the same time it's you're going through day in day out with your own life, also managing the care for a loved one, taking to appointments and all of those things. And if there is someone, whether if it's a friend or family member, whether it's a home care company, if they can take that load off your plate, maybe you're going to be there more as a family for them. So I would say that just being flexible, starting slow, I think, gradual transition, like we talked about earlier in the presentation as well, maybe a few hours a week, trying it out, maybe reaching out to friends or family for a few hours a week to get their support, and seeing how things are transitioning, and then putting all of that together over time as the disease or as the condition progresses. Maybe things would look different, but starting slow and having that set up in place.
Appreciate that answer. I think it's a really important topic to discuss as well. And I will speak about this a little bit later, but we do actually have a webinar coming up in May that is focusing on caregiver well-being. So I will share more details about that, but I think it's a really important topic there, Saeed. So thank you for answering that for me. Earlier, Bill, you actually mentioned about the kind of practical side of care, including cost and navigating the system. I just wanted to quickly share that for anyone that is looking for, access to publicly funded home and community care services, the first step is to connect with your local health authority. Now, this can be done by connecting in with the home and community care directly through the regional health authority or by calling 811 and they can guide you to the right services. And from there, you'll be connected with a case manager and a healthcare professional will arrange an assessment. And usually this is done in the home. And that assessment essentially is there to better understand the individual's care needs, the daily functioning, and the situation. And then from that assessment, they can determine the eligibility for services such as personal care, nursing care, and other community-based supports like day programs or social prescribing. It's important to note that these services are subsidized, but they may involve a cost depending on income. So it is means tested. And there can be sometimes wait lists depending on the level of need and availability in your area. But if this is something that you're considering, a helpful first step is sometimes to talk to your family physician or a nurse practitioner who can make a referral for you, or you can make that referral directly yourself with the local health authority. But another really great resource is actually reaching out to BC 211, which is a free and confidential service that helps people navigate health and social services, so they can help support you in understanding what's available in your area and help you get connected. But I guess, Bill, my question for you is following on from that information, what are some important things that the care partners should know when exploring care options, and what kind of questions should they ask providers and agencies in terms of that navigating the system and costs?
Yeah, I think it's a very critical thing to start early. Education can be just how it starts, starting to know the options out there. Yes, government care, if you can receive some form of government care subsidized, that is a good route to take. Many of our clients are receiving right at home care, and some also have government visits as well, and we definitely encourage that. I think that as you do the education process, there are a wealth of home care providers out there. Nurse Next Door, Right at Home are just two of the many options out there. I would really, spend the time and invest and talk to a variety of options, because it's not just, you will probably connect with the person that would case manage if you undertake the care, and how you get along with that person. They're essentially the quarterback for the team, and they will train and monitor the caregivers. They will be the point of contact and develop. I think building that rapport, I would encourage a free home assessment. Home assessments, I would be surprised if any home care company would charge you to visit the home. We always visit for free, and that is a good thing. You may start with calling 6 or 7, and you may call it down to 1 or 2 to visit the home, but I would encourage that. That's all part of the education. Pricing is very important with private pay because it's expensive for any family to add a cost that wasn't there before. So review the costs, look for any hidden fees, because I know some companies, they surprise you with things that they didn't tell you about, and you want to be sure about that. I would ask about protocols. I'm encouraged to hear Saeed say that there's certain protocols like 24-hour call line, visit notes. These are all protocols that are best practices. And if those are not being adhered to by another provider, you want to question whether that's going to jeopardize the quality of care and safety. I would also look at optimizing costs by seeing if there are any technologies the provider can do that can give you access to a technology that could lower your costs. What I mean is there are developing advanced AI systems that are low cost, that can be in the home and monitor things for safety and trends that no one is actually in the home. And we launched our first home monitoring system called Right Care a year ago, and it's building traction. And what we're saying is, okay, we're in your home for 20 hours a week. What about the other 148 hours a week no one's in the home? Well, nothing's better than a caregiver sitting in front of your mom or dad, but what about the other 148 hours a week? There's nobody. Well, this monitoring system can actually detect changes in trends. And I think, if a company cannot offer those type of elements, then may want to ask if there's anything that can lower costs through other means. We only charge $40 a week for this monitoring system at below cost. And so I think you want to just, all of these would require some time and effort because of the education involved, but you want to make the right decision. You don't want to, mom has a fall and now I need to put in care starting tomorrow. And you just have to take the first option out there. So part of that is that knowing that at some point in time, we have families that spend hours with us, we visited and nothing happens. 9 months later, dad has a fall and we're putting in care that night. And so that family will feel quite happy that they put in the legwork 9 months ago because they have in the back of their pocket the provider, that they know what it's going to cost, they budgeted, they've met the care provider, and they can start care tonight. And that pre-education and planning is something that I would definitely look at. So those are some of the things that I would think as you look for planning the future for your loved one.
I think that's a really good answer. And I particularly loved the touch on, using technology. Because you're right, it's there and it's there to make our lives better and easier, and we can kind of be creative. I previously worked with someone whose daughter lived abroad, and they actually installed like a door ring bell camera in the living room, so she could just chat to her mum, on a whim whenever her mum was in the living room, and that seemed to work for them. So you're right. I think it's being creative, trying different things, and being open to that sort of stuff. So thanks for that, Bill. We are now coming towards the end. So I have one more question for each of you before we move on to our Q&A portion of the webinar. So Saeed, I'll start with you. I just wanted to know if there is one piece of advice that you could offer to a care partner who is just beginning to think about future care planning, what would you encourage them to do first?
Yeah, I would certainly encourage them. I think, well, if I could leave one big message, I think out of today's webinar is there is support out there, and it doesn't have to be a lot. It could just be as little as the family or the care partner's needs necessitate at the time. So I think one message I would say is start to be proactive. Like Bill already mentioned in his previous answer, like they had an example of the 9-month difference between when they did the home assessment and when the care launched. It's very common in our field where we do see that. So being proactive, having the right contacts in mind, and then also knowing that support is out there, and starting those discussions maybe with the family member that is being cared for. Oftentimes, I think, as we discussed earlier on in the presentation, it's someone who has been independent right throughout their life. So it's a big change, and I think to accommodate that, the most important thing is to get that person's buy-in and having those discussions first, and then secondly, knowing that it could be a gradual start and support is out there. So that's what I would leave the people with.
No, I love that. One step at a time, slow and steady. And to close our conversation, Bill, I would just love to hear from you for care partners that are actually already supporting their loved one day to day. What advice would you offer for navigating changes as those needs evolve?
I think there's a variety of things which had been talked about, but I think at the top of the list is be transparent with your dad or mom what you're planning to do. Don't surprise them, right? Don't spend 6 months behind their backs and then say, we're going to bring in care next week, because you're not going to get the acceptance. I would bring them into, sometimes it's through a communal family discussion where 2 or 3 members are there. That's what we're doing with my own family. It's taken me a year to get my mom using a walker, but it's a unity approach. And you have to make them feel that there are benefits to them and it can be better for them, and that they're guiding the outcome of their future. So bring them in early, let them know what they're doing, and be transparent. And that's, I think, goes back to the dignity, the respect, because the last thing you want to do is put in care and, they don't even open the door. They tell the caregiver, get out. These things do happen, and you'll regret having done things without their consent. And I think they are the one that will be cared for, and they are the most important person. And we need to bring them in early and let them know what the plan is and participate in the plan. And so I think everything else becomes secondary to that. And I think that's part of the education process, educating mom or dad. You aren't losing your independence. You tell me day in and day out, you don't want to live in a facility. Well, if you want to live at home and you still want to walk to IGA across the street, we need to bring in care. And when they start to believe that you're not taking things away from them, I think then you get acceptance and cooperation. And I think that will lead to bigger and better things for everybody. Yeah.
Yeah. I think that you're right. The key word kind of there is it's hopefully going to be empowering for that loved one, whether that be, your partner, mum, dad, aunt, uncle, empowerment. And yeah, no, I really appreciate that answer. Thank you. Thank you both. So we are just going to have our Q&A portion of this webinar. So if you have a question, please feel free to use the chat function, which is just down the bottom of your screen. It just says chat, and you can type in your question there, or next to the chat function there is a raise hand. So you can click that and I can let you speak directly to the panel. We just have a question here. Will this be posted to watch later? Yes, we have recorded this webinar and we are planning on posting and sending it out. So I will ensure that everyone has access to that. Do we have any more questions? I mean, hopefully this means that Bill and Saeed answered everything. So Leanne's just asking, do services offer driving assistance for appointments to, for example, the grocery store? I don't know who would like to answer that.
Yes, we do.
Yes.
Yeah.
Oh,
Yo, go ahead, Said. Yes.
Yeah, that's a very common sort of a request. We do have driving healthcare aides who are insured and who have the ability to take our clients in their own vehicle to appointments, doctor's appointments, grocery appointments, hair appointments, whatnot.
Yeah, I think like us, we have caregivers with cars. Not all caregivers do possess their own vehicles, but if there's a request for someone having their own vehicle, then we will search for someone that fits that schedule and try to achieve that. Other times, sometimes they just take the bus together because that's actually an activity, waiting for the bus, and we'll keep them safe. So some driving caregivers can also assist them. Sometimes families find Uber works fine. So it could be a combination of both. But absolutely, going to the grocery store, whether it's a walk across the street or getting on some form of transport, whether their own vehicle, to go, because that in itself is mental and physical stimulation, and it's participating again. It's far better than sending the caregiver on their own, leaving the client alone in the house, and and going and picking up groceries. We can do that too, but we would prefer to have both of them go together. Yes.
Thank you. That was a really good question. It's good to know, again, being creative and kind of recognizing that that support looks very different. So our next question is there financial assistance for caregivers to cover the may not be covered by insurance or benefit plans? For example, lifts at home. I don't know if either of you would like to answer that, or I'm more than happy.
Yeah, I think usually when people are having a lift for the same time, what we had two lifts just in the last couple of weeks, and both were coming out of hospital, one out of Richmond General, one out of VGH. So sometimes the discharge planning team, the nurse charge in charge can help navigate. We, even at the inquiry stage, even if it's not a client of ours and they're still talking to 5 other home care providers, we can sometimes go in there and provide navigation. Usually what we know is that there are providers like Red Cross that provide rental assistance. Some of it is as long as 6 months for free to trial it out. There are other providers like HME Mobility that sell equipment. If someone is very committed to have care at home over the long term, then investing, a lift in the home is, $2,500 to $3,000. That's a lot of cost. If you're gonna live at home long term, then that's potentially a cost worth considering. If it's only for a temporary period, then a rental option may be more suitable. But there are plenty of options where you can trial and get a rent-free period. And that's what I would pursue as a first stage. The equipments are often the same based on the provider. There's others that sell it outright. But yes, right at home, our care managers can navigate, we can introduce, we can arrange visits and so forth. But sometimes it is unsafe not to have it in place before the discharge from the hospital and going home. So sometimes the return home is delayed because the equipment is being put in place. Yes. And that could relate to a walker, which is less cost. That could relate to the first time use of a wheelchair. Wheelchairs can be very useful within the home, and sometimes we use the wheelchair almost entirely in the home and bypass the stiff armchair that was used that's not supportive. They're sliding out. So some of our clients, it's not just as expensive as a lift, but other devices, a portable commode that can offer safety. There are a number of options out there. They can be retrieved from the hospitals themselves. They can be from the home care providers. And we ourselves, I'm sure Nurse Next Door as well, would love to provide navigation support in those instances.
No, that's a great answer. And I guess I just want to add on to that. So there is a BC rebate for accessible home adaptations. And so they can provide up to, I think, 20,000 in rebates for eligible households. Again, similar to the home and community care that is means tested. And then there are also other grants. So for example, the home adaptation for independence. But the best thing I would say would be to connect in with your home and community care, if that's the route that you're looking to take, and take that health authority assessment. And an occupational therapist, they're a great professional in this space to do that assessment, work out what is needed, and then help you apply and provide reports for that application. But what I'll do is I will include that information in my email post-webinar, so just so that you've got it there and links and everything to go. So we have one last question just before we wrap up. So what is the recommended guide for developing a budget? Maybe Saeed, you could answer that one.
Yeah, I think it's I would say maybe just navigating around. I think looking at the options, like we discussed earlier on, I think there's quite a few great organizations in the home care space. So doing the research, making sure that the pricing is something that suits your situation. At the same time, also, we might overthink the number of hours we may need, or underthink the number of hours we may need. So I think just having that home assessment, having the providers come in, do an assessment, seeing that, and like we said, all these home assessments are fully complimentary and free. So we can come in, we can take a look, discuss the care plan, discuss the needs, work with the family's budget, and then see how many hours we can then provide. So having that conversation can certainly be a great starting point there.
Just on that answer there, we've just had one pop in. How much money should we expect to pay per hour? And I guess it's probably quite a spectrum. But if you wanted to add any insight on that.
Yeah, I think it would be hard for me to sort of like give a range there, just because I guess every company is different. So, and every area is different as well. I would say every jurisdiction is different as well. So yeah, I think it is per hour most of the times. So maybe doing a research within the providers in the area would be the best way to go there.
Yeah, I
Yeah, I
guess
mean,
doing that research.
I'm happy to share. I think all companies have their own pricing model, but there's a certain similarity from what I knew. So we are pricing per hour based on the volume of hours per week. So at our lowest price per hour, it's $38 per hour for very large volume clients. That's over 120 hours a week, which is very, very high. And our smaller client cases are billed at $44 per hour. So that's our range. And that's based on the number of hours per week that they're subscribing to. Yeah.
Thank you. Sometimes it's nice to have a figure in there. But again, I guess it's research, isn't it? And it's figuring out what's going to work best for you and your family. So that's all the questions that we have. So I guess as we come to a close, I just want to take a moment to sincerely thank our panelists, Bill and Saeed, for sharing their time today, experience and insights. Thank you to everyone for those questions and reflections that you've added to the end of this conversation. They've been amazing, and I'm so glad that we were able to figure out those answers together. And, we know that planning for future care and navigating the caregiving journey more broadly is really complex. And at times it can feel really overwhelming. So I hope today's discussion has offered some clarity and reassurance and practical guidance. And hopefully you're leaving, feeling just a little bit more supported. Before we finish, I do just want to highlight that upcoming webinar that I mentioned earlier. So it's called Holding Space for Yourself in the Carepartner Journey, and that's taking place on May 27th at 10 a.m. And that webinar is going to focus on care partner wellbeing and the range of emotions that can come with caregiving, and how to support ourselves. That's with Olivia Bauer, who is the social worker at UBC Movement Disorder Clinic. So it will be a really great session. That's on our website at the moment, so feel free to register. As I mentioned, we're going to be sending out an email in the coming days just with a recording of this session, along with any resources that we've chatted about, and I will also include Bill and Saeed's contact details. But please know, if you have any questions, you are more than welcome to reach out to the Parkinson Society Information and Referral Team. So I'm just going to pop those details in the chat there. You can reach us via phone at 604-662-3240, and the extension for the information line is 230, or feel free to email us at info@parkinson.bc.ca. But again, I'll include that in my email. If you're anything like me, you need it written down. But that brings us to the end. So again, thank you so much, Bill and Saeed, and for everyone joining us. We hope we will see you at future events, and please, everyone, take care and have a lovely rest of your day.